When you're watching a soccer game, admiring your neighborhood gardens, or reading the signs in the aisles of your grocery store, you rely on your distance vision. And when you visit your eye doctor, checking your distance vision is an important part of the appointment. How well you see things far away is called your distance acuity. Your eye doctor uses several different exams to see how clear and sharp it is, and to see what they can provide to help. Let's take a look at how your doctor checks your distant vision, so you know what to expect and what your doctor is looking for. One thing to keep in mind with these, and all eye exams, is that you're not trying to pass the test or reach a certain level of accuracy. The goal is to find your results. That way, any prescription or equipment your doctor suggests will work for you during your normal activities. When we imagine an eye exam, the first test we might think of is that classic chart called the Snellen chart or the E chart. This is the eye chart that has a large letter E at the top, followed by several rows of letters that get smaller as you go down the rows. To check your distance acuity, your doctor may have you read down the rows to see which ones you can see clearly and which rows are too small for you. You'll do this test for each eye separately, then with both eyes together. You'll also do the test both with and without your glasses or contacts. Next to each line on the chart, a set of numbers shows the level of vision it represents, such as 20/50 or 2200. If the smallest line you can read is marked 2100, for example, that means you can see details at 20 feet that someone with typical vision can see at 100 feet. Check out Hadley's workshop on degrees of vision loss for more information on these numbers. Knowing how clearly and accurately you can see things far away can help your doctor make suggestions for glasses or contact lenses or a change in your current prescription. It also helps you understand why you might not always see things that someone else is pointing out and how close you might want to get to see them better. This test is usually done as part of your regular yearly eye exam, and it may be done more often if you notice changes in your vision or if your glasses don't seem to be working well. Not everyone can read the Snellen chart, so your doctor has other distance acuity tests they might do, including finger counting and hand motion. Your doctor might hold up a number of fingers and ask how many you can see. They might also ask if you can see their hands as they wave them in front of you. This helps your doctor understand how you're using your distance vision and what they can offer to help. Another common eye exam that's helpful for distance vision uses a device called a Phoropter or Refractor. This instrument looks like a large mechanical mask. While you're looking through the device at an eye chart, the doctor slides in lenses of different strengths and asks questions like, which one is better, this one or this one? And you let them know which setting helps you see more clearly. You might go through these steps several times, homing in on the type of lenses that work best for you. And when you're done, your doctor will be able to tell you your exact prescription. If you already wear glasses or contacts and they're not working well, this test will help you find your new prescription. If you have low vision, you might be visiting a low vision specialist, a specially trained eye doctor who may take you through some other tests. One of these tests uses a different eye chart, the Feinbloom Chart. This one has numbers in different sizes, and instead of being posted or projected on the wall, the Feinbloom chart can be moved closer to you to test what distance works for your eyes. This is useful if the Snellen chart doesn't work for you, and it can give the doctor a more accurate view of what you can see at what distance. For this test, you'll usually start by reading the chart when it's 10 feet away, and you're not wearing your glasses or contact lenses. You'll read as much of the chart as you can and let the doctor know when you reach the first lines that aren't clear for you. Then the doctor will move the chart closer, if needed, and you'll go through the process again. Another low vision exam that tests your distance acuity is called trial frame refraction. For this one, you wear a pair of glasses that have openings for lenses, and the doctor slides in different sets to see which ones work best for you. This is a lot like using a phoropter, but wearing these glasses gives you a wider field of view, so you can use more of your vision to find what prescription is right for you. These tests also help your doctor understand whether another device might be helpful, like a monocular, for seeing things at a distance. Check out our workshop on monoculars and telescopes to learn more. Distance acuity is one part of how your vision functions, but there are many more aspects to how you see. Your low vision specialist can help you understand how lighting conditions, different amounts of contrast, and even what time of day it is or how long you've been working on a task all have an effect. Be sure to check out other workshops in this series and remember that Hadley is here to help. If you need more information, reach out to a Hadley learning expert to learn more about how to make the most of your vision.